Welcome to the Birth Breakdown, a mini-sode series from Her Birth, Her Story. These short episodes are here to open conversations around pregnancy, birth, and postpartum. Things I believe every woman deserves to look into, to question, and just to feel empowered by. This isn't about telling you what to do or what's right and what's wrong. It's about giving you space to think, to learn, and to trust yourself a little bit more as you prepare for your birth. Let's break it down. On this episode of the Birth Breakdown, we are going to be covering the third trimester. We already covered the first and the second, so I'm excited to dive into this third trimester here. If you are in your third trimester, first of all, take a deep breath. Yay, this is the home stretch. You are in the almost there season, and it's super exciting, but it can also feel extremely overwhelming. And I'm sorry to break it to you, but sometimes this season, this trimester feels like the longest trimester. So today we're going to talk about what's kind of happening in the third trimester, the things that are commonly offered, maybe medically, holistically, and just things that first-time moms often don't realize and maybe they should look into. And just remember, this is not a deep dive. This is your, hey, here are some things that you should be aware of just to be able to make informed decisions. So the third trimester runs from week 28 until you birth your baby. And I'm not going to say until 40 weeks because we'll get into that as well. But a lot of times, first-time moms, you do not give birth right at 40 weeks. So you can be anticipating and excited, but that does not always happen. Honestly, it happens less times than it does more often. But your baby is rapidly gaining weight, developing their lungs and brain to be able to withstand outside the womb, practicing their breathing, and your baby is actually working to get into the right position to birth. So during this time, it is very important to do things to help optimize that position and to help the baby get into the proper position. Your provider will tell you what position your baby is in. During this time, you as a mama, you are carrying more weight than ever before. That precious baby is growing, just like you to help house that baby. You're probably not sleeping great at night because you are very uncomfortable. You will start to feel more pelvic pressure, and you might be having Braxton Hicks contractions during this time and just emotionally preparing or even maybe panicking a little bit during this time. This trimester is less about the growth milestones and just more about preparation and positioning, whether that's physically, mentally, emotionally, spiritually, because you are so close to having this baby. Now, some of the medical things that are offered during this time, again, this is not telling you what to choose, what to decline. This is just presented so that you are not blindsided with the things that they will either ask you to do, tell you to do, or whatever. We want to make sure that you are informed from beginning to end. So one medical thing that can happen during this time, we already talked about the glucose monitoring in the second trimester. Now, if there are some alarming signs from the first one, they may want to retest you if you didn't pass the earlier one or were borderline. Also during this time, they might offer to give you the Tdap vaccine, often offered between weeks 27 and 36. It's offered to pass antibiotics for whooping cough to the baby. Now, as a first-time mom and just moms in general, I just encourage you to look into the timing, what are the risks versus the benefits of getting it, and what's your comfort level? Do you feel comfortable? What is your intuition saying? Also, Group B strep test. This happens around 36 to 37 weeks, and this is just a vaginal rectal swab. This matters. If it's positive, they're going to want to give you IV antibiotics during your labor. So some things as a first time mom or just a mom who wants to be more informed when it comes to this Group B strep test, let's research, what does a positive actually mean? Are there any prevention methods that I can do right now to lessen the chance of potentially getting a positive test? And what are your options? Do you have to have the IV antibiotics? Are there other things that you can do during that time? These are all important things to look into and to be informed on your decisions. Now, next is the cervical checks. Some providers start offering these at 36, 37 weeks. And this is important for first time moms to know that you can decline these. Dilation does not mean prediction of when you're going to go into labor. You might be 3 centimeters dilated and still not go into labor for a couple of weeks. You could be 6 centimeters dilated and go into labor right away, or you could be not even dilated at all and still go into labor that night. Cervical exams are not an indicator of when you will have your baby. Also, during this time, they will encourage some ultrasounds for growth or positioning. And just remember, you can also decline ultrasounds, especially if you have looked into it and you feel like if it's not necessary, I don't want to do that. And that is totally fine. But they will try to do more ultrasounds if your baby is breech or measuring ahead or behind. But some things to look into when your provider are offering these things is, how accurate are the 3rd trimester growth scans actually? And what are the options if babies breech? Because just because they are breech does not mean that there aren't other things that you can do to help flip them. I personally have experienced this with my last baby that I just had a year ago, and I didn't realize all of the holistic options and medical options that you can undergo to help your baby be head down. Some holistic considerations during this time too. This is the trimester many women begin thinking more naturally and just proactively. And I strongly encourage you, especially as a first-time mom, to worry a little bit less about painting the nursery, making sure all the decorations are up and all of that. I understand where that's exciting. And if that's something that excites you, absolutely do that. But I would argue that what is more important than that is taking care of yourself physically, mentally, and emotionally, and preparing for your birth, but also preparing for your postpartum. Because a lot of times we prepare for the birth, but then we forget the postpartum, and a lot of things happen during that time. During this time, there are plenty of things that you should explore. Let's explore pelvic floor therapy, pelvic floor preparation, right? So some people are already doing pelvic floor therapy prenatally and during their pregnancy, and then obviously do it postpartum. I highly suggest this too. Look into perineal massage and proper pushing education. Also, if you are really trying to ensure baby's positioning during this time, you might look into the spinning babies techniques. I was doing this when I was trying to flip my son who is breech. Chiropractic care, make sure that they are Webster certified, because that means that they specialize in pregnant mamas. They're certified in that. Daily movement patterns. And let's look at some natural labor prep. A lot of times you're going to see moms recommend dates, red raspberry leaf tea, curb walking, just continuing to stay active because movement is important. Got to keep moving. And also, we cannot forget about the mental and emotional prep. This one is huge, especially for my first time mamas, because birth fears tend to surface here because you see the countdown of the weeks. You're getting closer to holding your baby, and that is when the fears start to come in, like, can I do this? I've been prepping, I've been confident. I don't know if I can do this, because you don't know what to expect. Take a deep breath and just know that you were made for this. You were specifically chosen to birth this baby. This is your baby. This is not just a baby. It is your baby. So some questions to ask yourself as you are prepping for your birth. Am I afraid? Because a lot of times this ends up being the first time mom's biggest fear is, what if I can't handle the pain? Next question, am I afraid of losing control in my birth? Am I afraid of the interventions that could be offered or used on me? Fear impacts your labor. Education decreases fear. Pregnancy and birth and postpartum are all a hormonal game, to where it is important that you understand the hormone impact behind your birth. Asking each of these 3 or 4 questions really helps you to be able to combat that fear and feel empowered going into it. Some things that first-time moms often don't realize, that I feel like this is so important, is that due dates are estimates, to where we are obviously eagerly waiting the arrival of our baby. So we're so excited, but just know, especially for first-time moms, going past 40 weeks is common. The due dates that they give you is just a guess date, and a lot of times first-time moms end up going past 41 weeks. And some things to just look into if you are worried about this or worried about induction is that you need to look into the induction policies at your hospital. What does that look like? What do they pressure you to do? What are they comfortable with doing? Because this is super important. Another question is, what post dates actually means? The second thing that I want first-time moms to know during this trimester is that you have options in labor. Don't let providers, nurses, anybody, friends, family that are in there, don't let them make you think that you don't have options in your labor. You should look at what type of movement you should do, monitoring, delayed cord clamping, position changes, who's in the room, and start asking now, not when you are in labor. That's why I am just very big in education and prepping yourself as early as you can, so that then you know what you're desiring. Everybody's on the same page as you, and it just really helps labor go more smooth. The third thing, your birth plan conversations should happen before labor. So when you're going into your labor, you should not be just handing everybody your birth plan and saying, oh, this is what I want. These conversations should be happening throughout your trimesters. And obviously in the third, you really should talk to your provider about these things and looking into what's their C-section rate. What's their induction philosophy? What is their comfort with low intervention births? Because all of these questions will affect the outcome of your birth, especially if you are wanting to do things from a more naturally minded, or you're wanting low intervention, or just wanting to make sure that it's a peaceful environment. You need to look at these things to know, is this provider what is going to work for me? The next thing that I want first-time moms to know is that your postpartum starts now. This is huge. You want to look into lactation support. Who will help you when you're at home? Your mental health resources, because a lot of times we don't want to look into this because we're like, oh no, I'll be fine. I haven't had any issues before. It's still just important that you have, whether it's a mental health professional, or it is somebody from your church or a trusted friend that you can confide in, just make sure that you have that available, so that you know if you're feeling wonky to where you need somebody, you can reach out to them and they will be a support for you. Another one too, during this time, freezer meals. I think one of the coolest things that I have seen, especially for moms who are on their second, third, whatever, past that, is that sometimes instead of having like a sprinkle shower or a baby shower, they actually just have people come over to their house and they spend the day making meals, freezer meals. They are cleaning the house, helping tie up any loose strings that are around, and it just helps because those freezer meals, especially for the first couple weeks after, you will thank yourself for doing that. Also, you should be looking at too, what does normal newborn sleep look like? Because a lot of times we get scared because they sleep a lot too, and you need to know what is natural, what is concerning, and just make sure that you have a trusted pediatrician already lined up, or chiropractor, or whoever you are going to be taking your newborn baby to, that is somebody who is trusted, so you know that they are going to be in great care as well. And just remember, third trimester isn't just about birth, it's also what happens after. And a lot of times we don't prepare for the postpartum part as much as we probably should. Why is this trimester so important? This trimester is so important because decisions get made, policies get presented, pressure can increase, fear can creep in. But also during this time, it can be so empowering, clarifying, and grounding. This is the trimester where you shift from pregnant to preparing. Education doesn't mean that you're just rejecting medical care. It just means that you're understanding it. You deserve informed consent. You deserve to ask the questions, and you deserve to feel calm walking into your birth. If you're in your third trimester right now, I want you to remember you don't have to know everything. You just need to know what questions to ask and just to feel supported. Take this episode as your gentle nudge to look into things. Talk with your provider, pray about it, journal about it, or just research what feels aligned for you. That's all for today's birth breakdown. If this episode sparked curiosity, affirmed something you've been feeling, or gave you a new perspective, I'd love for you to share it with another mom or mom-to-be who might need it. Make sure you're following Her Birth, Her Story, and if you feel called, leaving a review is one of the best ways to support this space, and it helps these conversations reach more women. Until next time, remember, this is your body, your baby, and your story. We are reclaiming birth one story at a time.